So moving beyond awareness and driving patient action, there's a few things that we need to focus on. First, at PHM, we work with PMX Lift, and we've been leading the charge in addressable video. We know that video is really important to pharma. It's a really strong performer forever, and also we know that pharma invests in video heavily. 57% of users are actually viewing video digitally. So we use our addressable tools to take a look at all of the partners and really deduplicate them. That allows us to minimize waste and also hone in on frequencies and making frequencies more efficiently. But what really allows us to get more to patient action is laying on that strategic audience. We're not just looking at a demo and an age, we're looking at data that allows us to know or that there's a likelihood of someone within that household having a specific condition. So that's what gets us closer to that patient action. And then second, we also know that educating HCPs allows patients to get on therapy quicker. So with our Lift practice, we are able to take NPIs and match them to the household, and then we are able to reach physicians. We often do this as an extension of our consumer campaign because we know that there's sometimes co-viewing happening, and we're reaching HCPs as well as consumers at the same time.
What role does digital follow-up play?
Digital and digital follow-up play a really important role in enhancing video campaigns. First, we would start with retargeting initiatives. We also take a look at competitive conquesting. When we see a brand competitor's ad, we're then able to serve our brand or a category ad and then follow that up with our specific ad. The other thing that we want to take a look at is those digital surround campaigns. So for example, take a linear spot that we're buying on the Grammys. You're going to want to follow that up with Vogue.com, red carpet pre-roll, YouTube, digital like music video buys, and of course that social multi-screen viewing, because when we're watching something linear, we're also always on our phone. Another big thing for pharma is they've been playing a lot in the Super Bowl lately. One of our campaigns, the last Super Bowl, was all about prevention. So we weren't only looking at that digital follow-up and digital surround sound, we were looking at channels beyond that. We were looking at pre, during, and post campaigns, and we specifically added on point of care as an additional channel because this was a prevention campaign. So we wanted to make sure that we were reaching women and reaching people while they were having their checkups and reminding them to go get screened.
So how do you measure success?
We measure success by having very strong partnerships with third parties like Crossix and like IQVIA. It's really important to pull a third party in here, and we've worked with them to kind of build what is right for digital video. We are taking a look at how the partners are performing individually, what the audience quality of each partner is, what the reach of each partner is per that strategic target, and also taking a look at cost efficiencies. We always want to keep an eye on that as well.
What's needed to make TV an even stronger catalyst for omnichannel healthcare journey?
I think what's really important when we're thinking about the total journey is it is a journey, and we really need to start with planning. We need to start with our own planning journey to focus on that patient journey. So at PHM, we have proprietary planning tools, and this system really allows us to take a look at that integrated journey. It's anchored in looking at real-time patient behavior. We are building audiences within our planning tool, looking at claims data and finding that strategic target. We're then looking at that integrated plan. We're looking from TV to video to social to point of care. And then within that same planning tool, we're able to look at real-time optimizations and measurement outcomes. And the whole time we're optimizing that journey and going back to the beginning as the campaign is live.
Now, looking ahead, what trends or innovations are you keeping an eye on?
We're taking a look at both trends and innovations. From a trend standpoint, the CTV boom. It's created this extremely fragmented marketplace. So users have all this content to consume, and they are turning to ad subscription models. We know that 2/3 of users are receiving an ad. That, from a marketer's perspective, creates a lot of supply. But when we look at all this supply, we need to keep our core values, our core planning values in mind, making sure that we're working with partners and content that are performing, making sure that we're looking at quality inventory, and also price efficiencies. From an innovation standpoint, TV has always been this lean back medium. Obviously, we've been doing a lot of social multi-screen, but with CTV, we're bringing the user into that experience. 2 examples. Pause ads. So if a user is going to pause their TV, pause the content they're watching, we can serve a static ad or a QR code and give them additional information about the brand. Or if we're looking at a commercial break, we can serve trivia questions, often around a disease state in the pharma space, but a viewer can pick up their remote and actually answer those questions. Both of those are allowing us to bring that viewer on an online journey to continue to find information that is relevant for them and their health.